Hi everyone, this is Dr. Karamachi. I wanted to chat about the numbers. There's a lot of hype in the media. Now there have 15,000 cases in the last 24 hours. So there's more community spread in Florida, which is concerning. And we're looking for the number of deaths or mortality, and hopefully that number will be available in the next 2 to 3 weeks. So far, it doesn't seem to be that big of a problem when we look at the numbers from the last few weeks. Obviously, some of these patients or clients will be in the ICU and they'll be getting treatments. And sometimes it may be 4 weeks later when we know, if there's more deaths or not. So we have to wait and see. There's a lot of concern and there's a lot of discussion online that we don't have, our deaths are low compared to New York City, the cases are high, and this is not a big deal, this is more like flu. That's still a possibility. This may be similar to a flu, and I'm not discounting that. But at the same time, based on what happened in New York City, the same thing can play out here where the virus may spread in the nursing homes, and we have senior population in the nursing home, and they're more at risk for death. And that's still a possibility that we are looking at. And unfortunately, even though they're taking all the precautions, if you look at my previous videos back in March and April, I thought the Florida nursing homes are doing a really good job. Maybe in spite of all the precautions, the virus is spreading because the employees, they go in and out, they go to their homes, there's a lot of community spread. They'll get it from other family members, and once they go into the nursing home again, they may be spreading it to the clients. So there is still a possibility that we may see a lot of deaths in the elderly folks in the nursing homes. And we noticed there are a lot more hotspots in the nursing homes in Pinellas County, in Hillsborough, Pasco County. So we're seeing new hotspots in the nursing homes and assisted living facilities, which is very concerning. We're obviously concerned about the young people, the people in the community. There's an occasional death here and there, and most of them are, they're either sick, they're in the hospital, or they go home, but most of them tend to survive. They're still a priority, but the bigger priority is the elderly folks who are in the nursing homes. Those are a higher priority because there's a higher chance of death in them. So we're constantly looking at the numbers, waiting and watching. If you just go by the number of cases, you may be misled. So the true numbers will be revealed probably in the next 4 weeks once we know the mortality of what has happened in Florida at this time. So as I posted before, I'm still waiting for the peak. I thought 10,000 was the peak, and now we're at 15,000. We'll wait and see when we reach the peak, and hopefully the peak will be another week or two, and after that the numbers will go down. The virus can only reach so many people. There are only like a few million people here in Florida. After that, the virus has nowhere to go. So that's what I'm hoping for. As usual, I would recommend you to, exercise every day. Do mindfulness, meditation, so forth. If you need links, I'll send them to you. Take supplements. I take vitamin C, vitamin D, and so forth. I've talked about different supplements in the videos. You can look at those. Try to eat a healthy diet. This is not the time to party. This is not the time to drink alcohol, and obviously this is not the time to smoke and go about those things. I notice some people are doing that, and part of it is they're probably bored because they have been, they have been stuck in their houses or apartments for the last 3 to 4 months, and they want to enjoy themselves. The problem is, as soon as you drink alcohol, let's say you have 1 or 2 beers, there's probably a lot of sugar in there. And the sugar messes up your immune system right away. And as soon as your immune system goes down, the virus now has the opportunity to get inside your system. So, obviously, once your body clears the alcohol, by next day, you may be feeling better, and your immune system may be back to normal. I don't know if it will be completely back to where it was before, but the chances are it will be back up to, where it can defend the body against the virus. So you would notice that the virus can still affect younger people, especially if they're indulging in these kinds of activities. It may be a temporary thing, and chances are the younger people may not die. And I still acknowledge that. They're at risk, but the chances are they're not going to die. We're also noticing there's a lot of spread in the healthcare workers in Florida area. I noticed some of the doctors are on the breathing machines here in Tampa area. And I also noticed some of the nurses and techs are also being hospitalized, which is essentially bad news. And once the healthcare workers are showing signs of infection, that means they may be unnoticed to themselves. They may be spreading the virus to family members, to the patients who are coming to the hospital, and so forth, and that continues the cycle of transmission. So that's briefly about the update about the coronavirus. I wanted to talk about steroids. It seems it's very hopeful. It seems that a lot of clients are getting benefit from dexamethasone, which we call it Decadron. That's the brand name. It's a cheap drug, obviously. It's not like remdesivir, which costs $3,000 and upwards. So it may improve mortality. That's what the recent study showed in UK. But I want you to be aware, just because you got Decadron and you got over COVID doesn't mean you're completely out of the woods. What we have noticed in other diseases is, again, I'm not supposed to use that information for COVID, but again, because of lack of information, I have to use information from other diseases and try to extrapolate it for COVID. What we're noticing is people with COVID can have long-term symptoms. We now have enough literature based on cases from February, January, and based on information from other countries that there is a version of clients who have who get over COVID, but then they don't completely get over COVID. So some of them have lingering cough, some of them have some amount of soft stools or slight diarrhea here and there. Some of them have stomach symptoms, abdominal pain. Some of them have neurological symptoms like numbness here and there, headache, and so forth. And some of them have a hard time recovering from loss of smell or taste. So that's essentially, the virus, the body's immunity is fighting against the virus, but it's not able to completely get rid of the virus. So when you take steroids, there's a possibility that the steroids can suppress the immune system, and you may feel better. You don't have the cytokine storm, and you're not on the breathing machine, and you may survive. But the possibility is the virus can hide, and then it can come back later. It can have another relapse. We call it a relapse when you have a second episode of the same viral symptom, or it can be a long-term like a low-level infection. So I want you to be aware of that possibility when you use steroids. And that can happen even without using steroids, but especially with using steroids, that's a significant possibility. So so that's all for now. I want to share those updates with you. That's my personal opinion about Decadron. I personally use Decadron in the patients in the hospital, and it is showing good results. I advocate for other doctors who want to use it. So I obviously tell my patients that there's a possibility that the infection can go away in the short term, but it can come back again because we are suppressing the immune system. Now, obviously, my personal goal is to make sure that we prevent the infection from happening in the first place, so that it doesn't disrupt your life. You don't have to take time off from work, and you don't have to go through the whole situation of being sick and being taken care of and all of that. And the best way to do that is to enhance your immune system. Work on exercising, eating healthy, taking supplements, and keeping your mind healthy also. And this is a very difficult time. A lot of people are experiencing anxiety, fear, and negative emotions, not only from COVID, but also watching news. There's elections coming up. There's a lot of financial stress, and I understand it is hard, but there are tools available. You can meditate, you can do yoga every day. So there are tools, mindfulness tools available to you that you can access at any time. So I wish you all good luck. So hopefully this will come to an end. We'll get over this. If you want to reach me personally, send me a DM. I'm always available. Okay, have a wonderful day. Bye.